And thanks everybody for joining us this morning. It's really great to see you here. Our hope with this index is that it becomes a tool for engagement with the different communities around end-of-life care. That can be governments, non-government organizations, international organizations, and those affected by end-of-life care, so patients, their families, and caregivers, and so on. We undertook this index really, as Po said, to look at the end-of-life care environment. There is quite a lot of talk about quality of life. There are a number of quality of life indexes out there, including one that we publish. But we really wanted to look at what is that end-of-life care environment and how can that be improved so people can face death in a more comfortable, a more, I guess, peaceful way. The objective here really was to create a tool that people could use to advocate, as I said. And as we did this, we looked at 30 OECD countries and 10 non-OECD countries. I'll go over those in a minute. The major research elements here were or are the basic end-of-life healthcare environment. We chose that really to look at the foundations of healthcare for those facing end-of-life care. It's really just kind of a context for the discussion. We also looked at availability, cost, and quality of end-of-life care. Of these, I'll go over the weightings shortly. Of these, the quality of end-of-life care is the most important, and we weighted it the most highly in the index through our discussion with experts. All of the analysis was conducted by the Economist Intelligence Unit through our global team of analysts. Palliative care, as defined by the World Health Organization, is an approach that improves the quality of life for patients and their families facing terminal illnesses. End-of-life care encompasses not just palliative care, but the broader context of kind of social and social and home care aspects, as well as institutional care. Hospice care is a very specific environment. I know particularly in the West there is quite a lot of discussion about hospice care instead of palliative care. So we've used that in a very specific context throughout the report. In the index itself, we looked at the 30 OECD countries, mainly because these are the countries that are by and large facing demographic bubbles with populations over age 65. Japan, I guess, is the one that many people talk about today that is in the midst of kind of that dilemma facing an old age society. We also took 10 non-OECD countries. Those countries were chosen partly to get a balance of other Asian countries, including Singapore, Malaysia, and so on. We assumed there would be quite a lot of questions about the BRICS, Brazil, Russia, India, China, so we included those countries as well as places like Uganda, South Africa, and other locations where the end-of-life care and hospice environment has really come up as a result of societal and social aspects in those countries. On the structure of the benchmark itself, we have these 4 sections: the basic end-of-life care environment, availability and cost, and quality of end-of-life care. As I said earlier, quality of end-of-life care really was weighted the most, as we discussed within our team and with experts in the field. This quality of care includes things like, training for doctors in medical institutions, the public discussion around end-of-life care, and so on. Availability really looks at are there palliative care and end-of-life care activities for that community? Is there a national strategy, etc.? Cost looks at the burden on patients, and the basic end-of-life healthcare environment looks at really the healthcare infrastructure in those countries. Just a couple slides here going over the specific indicators. I think some of the discussion that we've had with people so far when this has been released has looked at things like individual indicators. And what we need to keep in mind here is under the basic end-of-life healthcare environment, this is 20% weighting of the index. But when we look at, say, items like healthcare spending as a percent of GDP, that is 15% of that 20% weighting. So when we look at the final numbers, we're taking the data times 15% times 20%, and that sums up to create the total score. So you'll see that these final scores aren't from a 0 to 10 scale. There is no perfect 10 within the index. They're all a sum of the weighted components of the index. So I can explain that more later if you have questions on there. Availability was ranked a bit higher than the basic end-of-life healthcare environment. Cost of end-of-life care had a 15% weighting. Our justification for that, after speaking with people in the sector, is that it really is a good that is demanded. If you are facing end of life, many people will pay for those services out of pocket. People want curative and palliative care if they need it, so they'll pay what they can. And quality of end-of-life care, again, was the most highly weighted element of the index, most highly weighted section of the index. The types of indicators that we used, we had quantitative indicators, qualitative indicators, and status indicators. Most of the indicators were quantitative indicators gathered from international organizations like the World Health Organization, national statistical bureaus, and discussions with organizations like national hospice and palliative care organizations. Qualitative indicators were rankings, where we looked at items like public awareness, where we spoke to individuals in countries, analysts and observers of the field, and we ranked, we ranked individual indicators on a 1 to 5 scale. And then we had status indicators, for example, the existence of a national palliative care strategy or end-of-life care strategy, where they were ranked yes, no, or in progress. So there are a few countries who have that end-of-life care in progress. For data sources, we looked at nationally recognized international sources like the World Health Organization, national statistical offices, and other national data, as well as interviews. We did quite a number of interviews for this piece of work.